Hey everyone, it's Angela Artolino with It's a Dog's Life, and my today's guest is are you a vet?
I'm not. I'm a DC and a CCRP.
Okay, so tell us what the difference is before I introduce you. And so that we know, because that's what we're like, how does this work? Because I know you started in the human side of things and went over to the animal things, but first tell me what that means.
Sure. I've been in practice for almost 20 years. I qualified as a human chiropractor in South Africa, and then I came across to the States and I studied to do animal chiropractic. And then I went on and did the CCRP course, which is a certified canine rehabilitation practitioner course through the University of Tennessee.
Awesome. Very cool. So who I have with me is Dr. Michelle Broadhurst, and she told you what all of her fancy initials meant after her name, but I love that you went from the human to over to the animals, which, I don't know if what happened to me is when I studied cannabis medicine and I realized that the animals could benefit even more than we could. And I love animals, prefer them over humans. That's why I jumped over to that. Was it kind of the same type of thing with you? What made you go, I want to get into learning all about chiropractic, to, I want to do animals?
I think for me, it was I've always been an animal lover all my life. And to be honest, in South Africa, we didn't really have any exposure to animal chiropractic until a friend of mine said to me, you know what, you should really go and do this. And I was like, oh, that sounds amazing. So my history on the human side is that I'm a chiropractic sports physician and an acupuncturist, as well as being a chiropractor. So
Awesome.
I already had a really multidisciplinary practice, which incorporated a lot of functional and structural medicine. So I was like, wow, that could be amazing if we could bring this to the animal world, because there just wasn't a lot available back. Oh, I'm aging myself, but back in the early 2000s. Um, so I was like, that's amazing. So I took the leap and I came across to the US and I studied animal chiropractic and I just loved it so much. And I started my practice I incorporated it into my practice in South Africa, and I had this really big, small, and large animal practice where I specialized in racehorses and thoroughbreds, so on the stud side as well as on the performance side. And then
Wow.
obviously it evolved into everything. And then the dogs were just such a pleasure. So my practice was just wonderful. We would have dogs coming in the one door, people going out the other door. It was just because my husband's a chiropractor and an acupuncturist too. So we had this
Oh,
amazing
awesome.
energy and really diverse clinic. And what's always just been amazing to me about it, as you've seen in the cannabis world, and just we were so blessed in South Africa where we were incorporating that into our practice by using other specialists at the time. And we saw amazing results because animals don't have placebo. So you can't tell an animal that they're doing better. They either do better or they don't.
Yep.
So they're very honest. So when you're in that position, you know whether your treatment is effective or not. And so the chiropractic started, and then I was like, this, functional and structural medicine in the human world really works. Let's look at it on the animal side. And that's when I went into the really functional medicine side of incorporating needles and laser and modalities and rehab along with the chiropractic side. And it's just been amazing.
Oh, I love it, because I'm sure once you understand how the systems work and what's going on, it makes you just lead to one to another. And of course, I'm the pet cannabis expert, and I know it's going to work well with
Yep.
acupuncture and chiropractic. I just know it because it's going to open things up. It's going to relax. It relieves inflammation. So I just know it's going to open up the signals and the communication between the brain and down the spinal cord. So I think they fit so well together. I love it. What are like some of the common things? Because to me, I can spot a dog and look at, like, all my dogs I know need adjustments right now. They're way past their adjustments because of the pandemic. Because I have a shop also. So we have acupuncture and chiropractors come into our shop like once a month, and people come and see them because it is hard to find
Yeah.
people like you. And you're in Colorado. But where I'm in Florida, and I have a choice between 2 or 3 true chiropractors and acupuncturists. And I say that because there is a vet. My old vet used to be, it says she practices East West, but she really hasn't practiced East in a long time. And there was a big difference between going to her and going to someone like you, who this is what they specialize in.
Right.
So a lot of students will go to our vets and they don't offer this. This is something we have to ask for and get a referral and find out, or we Google what is the best way. What should we do
So
if we're looking for someone like you?
So every state is different. I would say if you're looking from a chiropractic perspective, the International Veterinary Chiropractic Association, the IVA, .de is a great website, as is the American Veterinary AVCA, American Veterinary Chiropractic Association. I think it's avca.com if I'm not mistaken. But those are great sites so that you know the person who's going to be touching your animal is educated. It's not an easy exam. It's not an easy certification. So you know that the hands that are getting on that animal have had some training. Because that's the biggest problem, is that animals are not people dressed up in furry costumes. And on the flip side, it is a skill set. So if people look at what we do and they go, wow, that looks really easy. And a friend of mine's an anesthesiologist, and I say she's got the best job in the world because she just watches people sleep for a living. And she goes, yes, until something goes wrong. And that's a really good point. So you really want to make sure that the animal that the person that is getting their hands on your animal is equipped as much as they possibly can be. So those 2 sites are really great to look at. So, reviews and things like that are helpful. A lot of people don't really worry about creating a review process, but word of mouth is very helpful. And one of the things that I stress so much when I lecture is that the importance of integration. So, you can't be a jack of all trades and be good at everything. Right. So I think one of the things that's really important
Stay in your lane is what I'm always yelling. Stay in your lane. Yes. You are the expert in that. And that's why I'm going to go to you, because you spend all your time learning about that. And it's not like you learn and you stop. You're always learning, because there's always going to be advances and discoveries and research that are going to continue. We learn, and then we do our jobs better and better. But yeah, I'm constantly saying, stay in your lane. And in my industry, the cannabis industry, I'm yelling that from the rooftops, because everybody thinks they're going to come up with a CBD tincture now or white label something. And I'm like, no, you make shampoo. Why are you making a CBD tincture? So it's crazy.
And that's absolutely true. And if I can add to that is find your tribe. And that is the most important thing. Is, I've been doing this for a long time. I'm very secure in what I know. I know what I don't know, which I think is more important. And there are amazing practitioners out there that do what I don't do. And that is the biggest thing in the industry right now, is I think if people could understand that there's not a problem saying this is not in your lane. Right. But because it's in somebody else's. So create the tribe around you that you can work with well and integratively. We are, no man is an island. And that's the most important thing. I'm really good at chiropractic and rehabilitation, and I teach myofascial pain. That's my jam. What I know about veterinary cannabis and CBD, I've been very fortunate that in South Africa, it was a little bit like the Wild West. So we had a lot of integration. And, it was wonderful because I got taught by these people who had been doing this, and that was all they did. And the same with the acupuncture, in the animal world. I have amazing acupuncturists that I send to. And if we all work together, our patients get better. Yep. And the clients are happy. And isn't that really what we're trying to do?
Yep.
Unfortunately, though, there's a lot of insecurity about saying that's not in my lane. And we shouldn't feel like that, because there are people like yourself who this is your jam. This is your lane. You own the lane. It's awesome. And there are other people in your lane that are wonderful too, but that's not everyone's lane. So why would we try to do that and get a half-assed response. And it kills me, because I'm a huge believer of CBD and cannabis in veterinary. In South Africa, it was wonderful. We had a lady who had about 100 plants that she was growing.
Awesome.
And people would take their dogs there and they would self-select.
Oh, I wish.
It was
That's
amazing.
dreamy.
It was
I wish I could
amazing.
do that.
And then she would create medicine for them with that. And then they would come back 2 or 3 weeks later and check that they were still in the same place. And so often the dogs would change because they need another cannabinoid or another, it was just amazing to watch. And so
That's
that
like
was
my
very
new
cool.
goal now in life, to have
Oh,
a
Angela, it's
field to let
amazing.
them. Oh, I love that.
Because
What a
dogs are so
wonderful.
good at self-selecting, and that's the thing, is that cannabis is a especially with the endocannabinoid system, it's something that's evolving all the time, and then they need something else, and that's what I find fascinating in that world. But a lot of people will say to me, oh, I tried CBD, it didn't work. And I'll go, did you shake the bottle? And they were like, why? I was like, there are different densities. Oh, I never even thought about that. I was like,
Right.
okay, well then you need not in the right company. Whoever's selling you this needs to educate you better, because education is power.
Yeah, it absolutely is. And we need to know that, we need to remember that chiropractic, acupuncture, cannabis medicine, full spectrum hemp extract, all these things we wouldn't know about. We know that they work. So we know there's going to be bad players in it. And we have to do our research, and we have to figure out who are the good ones and who are the bad ones. And I can look at a dog and go, okay. I can look at my little old man dog and go, yep, he needs an adjustment. I can see that he's holding this leg a little stiff. And, Nina, I have a Doberman with osteosarcoma, so all the weight is shifted onto the other side. So I could definitely see how crooked she is. But what are some signs that they're a good candidate and that would really help?
So starting at the beginning, one of the biggest things we need to realize is that there's a pain response. And we don't always acknowledge that pain response. So not to geek you all out a little bit, but
no, we love to geek.
The same area of the brain, which is called the anterior cingulate cortex, that computes basically the painful information that comes to the brain, is also the one that actually changes in the emotions in an animal. So we've seen this in human studies with fibromyalgia, is that the same area lights up on contrast MRI and CT scans and all of these things with pain as it does with the center that actually controls how the people feel about things. So one of the first signs I would say is watch for a change in behavior. And that's a very subtle sign, but your dogs better than any vet would ever know them, any person would ever know them. So, seeing a change in personality is a very, very big one. They don't want to climb the stairs anymore. They're hesitant jumping onto the couch if that's what they've always done. Gross things that you're looking for is obviously limping, holding themselves in a different position, their tail goes off to one side, their neck might be a little bit skew, they whimper or they cry when they do something. Stopping is a big one too, like you're taking your dog for a walk and he stops and sits down for a little bit. All of those sorts of things. Lick granulomas are very, very common. So we start seeing self-mutilation, because it's a little bit like a bad Steven Seagal movie where he's been shot in the leg, but he's got to go save the day. So he like stabs himself in the arm. Dogs do that instinctively because they can only really deal with one pain at a time. So they actually create an acute pain response to a chronic pain, so they're not feeling the chronic pain. They're going to feel that acute pain. So with lick granulomas, post-surgical, really important.
So I want to make sure our audience understands what the lick whatever is called. But dogs, it's also a way of them releasing anxiety. So
and
Odie,
endorphins.
Right. So it's great. And so they will lick their paw until they create a wound, and they will not stop. And what's interesting is that behaviorally is that even when you do take care of the problem, sometimes you have to stop the bad habit still. So when I get dogs that are super, super itchy and have allergies like crazy, and then they get a CBD and everything seems to relax, but sometimes they still go to lick that paw. Now it's a training issue and it's a bad habit we need to break. And you can. I've done it. I'm not gotten. Have had 9 dogs at one time, and it's possible. I promise. So I just wanted to make sure that people knew what that meant, because they've got to let out that anxiety somehow. They've got to do something about it because they can't voice it to you. So we have to recognize when it's happening.
100%. And that's what animals, and that's why they're so beautiful to watch, because they always want to be well. They don't become part of their problem. So if you have an osteoarthritic dog, all he wants to do is run and be good.
Right.
And that's our blessing and our curse, because when they do get better, they overdo it and then they get hurt again sometimes. Right. So, that endorphin response, as well as the endogenous opioid response, is really important with the descending pain pathways. And that's what we're trying to do through functional and structural medicine, is we're trying to dampen the pain response, so that we get all these beautiful endogenous opioids, we get all of these changes going on, so that the communication between the cells that are telling the body that it's got an enormous amount of pain becomes dampened, and they have a much higher quality of life. So,
Amen. So that, yeah. And that's why when people are confused, when we have had lots of Frenchies where they have been lame and they've stopped using their back end and have taken 1 dose of a full spectrum hemp extract and gotten up and walked again. And the longest was 4 years. And how the hell is that possible? Am I a witch? How did that happen? And it's as simple as getting rid of inflammation and opening up that communication again. And that dog knew what to do. Now, of course, the dog needs to physical therapy, chiropractic, acupuncture to get everything working again. But that's literally what we did, is that we just got rid of some of that inflammation, so that communication. And I don't think people understand how we're connected like that.
Absolutely. And the most important thing is retraining the brain. Like you were saying about the lick granuloma, it becomes habitual, always chasing that endorphin high, always chasing that serotonin high, because it makes them feel better. So it becomes a learned response. And that's why I think integrative medicine in the veterinary world is becoming so much more important. Is you can't fix everything with a pill, but you can fix it with herbals, you can fix it with chiropractic, you can fix it with acupuncture, you can fix it with physical therapy. And very often it's a combination of everything together working innately. And when I use the word innately, it's the body's natural mechanism to be well. We're taking away restrictions, we're taking away blockages, we are putting back what we've lost and making it much better. It's almost like rebooting a computer. And then we need to learn, we need to teach the body how to connect the dots again.
I love it. It's so true. And we have an entire system that's responsible for keeping us well. And if we can support that system and what it needs, then we're halfway there.
Absolutely. And there are times where we do need conservative drugs, but having that helping hand at the same time that can support the system and allow it to do what it does naturally. I always laugh when patients ask about CBD, because I have a bull mastiff patient that falls over on 5 milligrams, which is insane because he's like 150 pounds. Yep. And there's a Chihuahua, which is about 7 pounds, and she takes 28 milligrams twice a day.
Yep.
And it's just what the body needs. What do we need to put back? And that's the important thing too, is knowing that there isn't one formula. And I love that, because we should never be boxing anybody or anything, because every being is completely different. So we have to treat them as such.
Mm-hmm. And I agree. I have the same experience all the time. So I'm sure you get aggravated when you see, if it's 10 pounds, take this much. If it's 20 pounds, take this much, which I understand we've got to start somewhere for people, but that's not how it works. And I think people don't want to trust themselves and go, okay, I can figure this out. I got this, Mm-hmm. But it's true. Every animal's different, and every animal's deficiencies are different. Everyone's blockages are different. You know, everybody's kinks are different. So we can't just say this is what you do. But these things will help. They'll all help.
Yeah.
And we have to remember that our vets aren't taught about this. You know, they're not taught about this in school, and they can't be taught about everything that's wrong. When we go to a human doctor and there's something wrong with their head, then they're going to send us to the head specialist. Acupuncture, natural medicines, these alternative treatments that help us so much and put our bodies back into a position so where they can heal, where they are balanced, which is the whole purpose of the endocannabinoid system, is to keep all of our other systems in balance. So you guys can see why I'm always bringing in people like you, Dr. Broadhurst, because they do go so well hand in hand, go well together, and there's no harm, all good. Nothing bad happens when it's always good, so that you really have nothing to lose when you're doing this for your animals. I want to know what your first, aha, oh my gosh, this is the greatest thing, to, maybe, your first amazing experience, to like, what are some of the wonderful things that are happening now later in your career with benefits and how it's helping our animals?
I'm smiling because I'm looking back on probably in about, oh gosh, the early 2000s. I had this little Dachshund come into my practice, and they were two elderly owners, and they were sitting in my reception area, and they're both in tears because they had just come from the vet, and they had literally stopped in my practice, and they were like, "You need to help me. They want to put my dog down. He's paralyzed. He's incontinent, urinary and fecally incontinent, and they say it's over, and we don't have the $8,000 to $10,000 to do the surgery." And I'm like, "Okay,
And what
let's give it."
surgery were they recommending?
A discectomy, so they take the disc out of the spinal cord so that there's no pressure. So this dog had an IVDD, or has had an IVDD.
And remember that most of these dogs do. This is, would you say, the most common breed that gets IVDD?
Yes, so Dachshunds definitely. We also see it sometimes in any dog that has got almost 2 or 3 vertebrae too long for their little legs. So the short-legged dogs are very, very prone to this, because they're almost a little bit like a slinky, where they have that little dipping point in the middle of their back where their thoracic spine meets their lumbar spine, so their mid-back meets their lower back, and that's the most prominent area for these discs. And unfortunately, what happens is that the disc material exudes, so it goes out of the disc itself and it sits on the spinal nerves, and then it paralyzes the dogs, and nothing works in the hind end. And these poor clients were just completely devastated, and this little Dachshund's looking up at me, and I'm like, "Okay, let's go." So we adjusted the dog, and we did some other clinical functional medicine with him, and we crate rested him and I was like, "Okay, we've got to crate rest him because we've got to get this body to heal." And they came back twice a week, which is a lot for me. I don't normally do it in such quick succession, but the body was really acute, so we had to. And by the third adjustment, this dog was no longer incontinent of any sort. He had this great little Beyonce wobbly gait, but he was on his feet, and we had managed to get his superficial and deep pain as well as a portion of his conscious proprioception, so that like he wasn't knuckling as much as he was before. And within 6 weeks, he was walking and he was back to normal.
Awesome. And we see this all the time. Yeah. And when I hear people say we put our dog down because he stopped walking, I'm like, oh my gosh. And that's because our vets don't know better. This isn't what they were trained in. So there are alternatives. And like I said, we had a French bulldog who was lame for 4 years, and he didn't believe me. We gave him a bottle of it, and he was like, "I'm just going to try it." Gave it to him, and then went upstairs, and she was upstairs with him, and he turned around and could not believe it. So it is getting rid of that inflammation, doing that adjustment. Okay. And tell me about your specialty. Myofascial?
Well, yeah, so I've written a couple of books about myofascial pain in the canine patient as well as the equine, because I integrated those two worlds so much in my practice in South Africa. Is, one of the things that we often do is we become very very focused on our on just one thing, like structural medicine. And neurology and chiropractic, and we don't look at the functional element of things. And there's always that combination. Very seldom do you just have a structural issue or just a functional issue.
Yep.
So even if your dog has torn his cranial cruciate ligament in his knee, we now have a knock-on effect through the entire fascial and muscular system that needs to be treated, because now he can't weight bear on that leg. He's going to be overloading the other leg and the contralateral forelimb and everything in between. So if we don't address those problems, that dog may get better with surgery, may get better with whatever it is that we're going to do, but they're never going to be optimal because we're not treating the compensations. So I teach about myofascial pain. I teach about dry needling, which is an incredibly effective technique that not many people in the United States knows about. It's very quick, it's very efficient, and the dogs just do amazing with it. So you know, we need to marry those two things together so that we are really closing the circle, if I can say that, you know, and incorporating things like CBD, cannabis in a lot of cases too, you know, from a pain control. And like I say, not my area, but we have wonderful people in that world. There you go. And that's exactly it. Is like we need to create the most optimal environment so that we don't have a recurrence of this issue, and that we clear out those pathways correctly once and for all. And of course, we always compensating. You sleep wrong, your neck skew, you know, then your other shoulder starts to hurt, then your back goes out of whack, and you know, then we keep treating that one thing, but we need to actually see it as a whole and really concentrate on treating truly holistically. And when I say holistically, I mean with a W, not an H. Is really treating the body as a whole functioning system, as opposed to little bitty parts that don't fit together.
Right. Or taking care of this part and messing up this part in the meantime. I don't understand how any of that works or why we would do that. It is what led me down this cannabis journey, is when I was offered a pharmaceutical drug for my rheumatoid arthritis that causes lymphoma. Yeah, no, thank you. Let me go to this all natural, which doesn't cause cancer. It actually kills cancer. Thank you so much for joining us today. Tell our listeners where they can find your information, follow what you're doing. You said you had 2 books. I'm sure we can go on Amazon. What are the name of the books? What's your website? How do we follow you?
So my website is www.drmicheleb.com. And if you just type in Dr. Michelle Broadhurst, you'll be able, a whole bunch will come up on Google. And yes, the books are available on Amazon, and they are called A Clinician's Guide to Myofascial Pain in the Canine Patient, and A Clinician's Guide to Myofascial Pain in the Equine Patient.
Awesome. Thank you so much for joining us today. We learned so much, and we really appreciate your time and what you're doing for our animals.
Thank you so much. It's been a blast.
Bye.